Hello, I'm David Holmes. I'm president of the American College of Cardiology. It's a pleasure to be here with you to talk about the TVT Registry. Transcatheter aortic valve replacement is a transformational technology. It's technology that's now been approved in the United States that has the potential to dramatically change how we treat patients with structural aortic stenosis. The TVT Registry is the result of active collaboration with a surgical society, the STS, and the American College of Cardiology-NCDR. It is aimed at evaluating the early as well as longer-term outcome of all patients in the United States who were treated with transcatheter aortic valve replacement. And so I'm terribly excited about this. This is new technology. We need to make sure that we get it right. And ACC, working hand in hand with STS, I think offers with the TVT Registry the potential to make this optimally dispersed in terms of the application of this new technology for the American population. And I hope that you enjoy this presentation.
Thank you for your interest in the STS ACC TVT Registry. The Society of Thoracic Surgeons, STS, and the American College of Cardiology Foundation, ACCF, are excited to introduce you to this new registry developed to track transcatheter valve therapy procedures. We have three objectives for this presentation. We will provide a brief, high-level review of the development of the TVT Registry. After that, we will review critical features of the website. And finally, we will review the material you need to be aware of in order to join the registry, as well as the resources available to you. Let's begin with the history of the TVT Registry. TAVR trials in Europe led to the first valve being awarded CE approval in 2007. STS and ACC began discussing creating a TVT registry in early 2011. Through a collaborative effort and working closely with the FDA and CMS, we developed a TVT dataset and definitions. In the U.S., the FDA approved the SAPIEN valve from Edwards Lifesciences on November 2, 2011. STS and ACC launched the TVT Registry December 1, 2011, to capture patients with an approved FDA device for transcatheter aortic valve replacement procedures. The registry was not mandated at this time for TVT procedures. Currently, there is no CMS coverage decision. However, we do anticipate a decision around June 2012. On the registry's website, tvtregistry.org, you will find a description of the registry and links to more detailed information. The navigation bar on the left side of the page provides these additional links. The following are the links found on the left-hand navigation. In a separate webinar we have created to train those who will be entering data, we provide an in-depth review of tabs accessible only when you are logged into the website. The links shown here, however, are available on the public portion of the website. You can navigate here at any time. No password is necessary to review this information. This page describes some of the data collected on a high level. Please note that our Data Collection tab contains the current data collection form and the data dictionary that we developed for registry participants. This form and dictionary are in a PDF format and can be saved and printed from your computer. You can have your staff begin to review this information now, prior to completion of the paperwork and contract. Here is a high-level overview of the data points that are collected. These include patient demographics, provider and facility characteristics, history risk factors, cardiac status, and detailed health status, well-defined indications for the procedure, pre, intra, and post-procedure data points and adverse event rates, outcomes at 30 days and 1 year. The TVT Registry was developed through a partnership between the Society of Thoracic Surgeons and the American College of Cardiology. Representing 35 years of registry experience, more than 100 years leading the cardiology profession, and more than 40,000 members worldwide combined, the STS and ACC form a distinguished partnership fully equipped to take on this important initiative. Founded in 1964, the Society of Thoracic Surgeons is a not-for-profit organization representing more than 6,200 surgeons, researchers, and allied healthcare professionals worldwide who are dedicated to ensuring the best possible outcomes for surgeries of the heart, lung, and esophagus, as well as other surgical procedures within the chest. The mission of the Society is to enhance the ability of cardiothoracic surgeons to provide the highest quality patient care through education, research, and advocacy. The American College of Cardiology, a 40,000-member nonprofit medical society, is dedicated to enhancing the lives of cardiovascular patients through continuous quality improvement, patient-centered care, payment innovation, and professionalism. Comprised of physicians, nurses, nurse practitioners, physician assistants, pharmacists, and practice managers, the college bestows credentials upon cardiovascular specialists who meet its stringent qualifications. Supporting organizations. The TVT Registry was also developed with the Federal Drug Administration and the Centers for Medicare and Medicaid Services. With valuable input from the Society for Cardiovascular Angiography and Intervention, the American Association for Thoracic Surgery, and Edwards Life Sciences. The best way to get started with the registry is by using the information and enrollment page shown here. Filling out this online form and selecting the Submit function at the bottom of the form will provide you access to the enrollment kit. In addition, it creates an email which is sent directly to us, so we can then follow up with you to assist with enrollment or other questions that you may have about the TVT registry. Another option is to request an enrollment packet, which you can do by calling or emailing us. A substantial amount of information has been published on TAVR procedures. As an additional feature, we have numerous articles and links available on our TVT resources page. This is again on the public portion of our website. The articles will be frequently updated to allow this page to serve as a true resource. Once the enrollment process is complete, your participant ID, username, and password will be emailed to you. Using your participant ID, username, and password, you can log in using the link in the upper right-hand corner of your screen. Keep in mind that the individual you list as your registry site manager will be the individual who will receive this critical email from us. You are required to designate a staff member as a registry site manager who will assume this function. He or she will then be the contact between you, your hospital, and this registry. We have additional training sessions and webinars developed to train and assist these individuals and others at your site on data collection, submission, and quality improvement. Once you have joined the TVT registry, there are password-protected, private pages that can be viewed and are very important for your participation in the registry. We will discuss these private page links, shown here at a very high level now, but will conduct more in-depth training for individuals once participation has started. The private page for resources provides the data collection form and Coder's Dictionary as the public side does. There are additional links for the full data dictionary in both PDF and Excel. The full data dictionary is proprietary, and that is why it is available only on the password-protected pages. Each individual you want to have access to your hospital's private pages is required to have his or her own unique username and password. Your hospital's designated registry site manager can create a login and password for additional individuals. Once that is done, each individual will finish creating his or her own profile. Within the administrative tabs are options to select preferences and privileges. On the screen shown, you can see some of the email options available under the Preferences tab. We do use email as our main form of communication. The number of emails received and who receives them can be controlled by each individual. The site profile should be filled in and kept up to date by the Registry Site Manager. This page contains information about your hospital site and contact information for certain individuals, such as the medical officer and billing contact. Also, within the password-protected portion of the website is the Data Collection Tool, or DCT. Shown here is the Patient Management page of the DCT. We provide more in-depth training on the DCT when a site becomes enrolled in the registry. Once registered, Our participants have access to on-demand training webinars that discuss each process of data entry and submission. Conference calls are also held regularly. Under the Operator Setup, your site will enter data on the physicians who perform TAVR procedures. This allows your site to enter the data once and then recall it in a drop-down menu in the DCT. This prevents you from having to enter the physician information manually each time he or she does a procedure. The RSM is responsible for keeping this information up to date. Within each page of the DCT, there are potential pop-up messages or warnings that indicate where there has been an error in data entry. These pop-ups are used throughout the tool to reinforce that data needs to be as complete and valid as possible. The message on this screen shows an example in the tool where these errors can occur. In addition to the DCT error pop-ups, we also have a quality check system that will list specific information that is not complete or in error on the patient. This again assists with collecting the data at a high level of completion.
We hope that you have found this instructional video on the new TVT Registry informative. The TVT Registry is a new endeavor by multiple stakeholders in the field of transcatheter valve therapy. The American College of Cardiology NCDR database, the Society of Thoracic Surgeons, Adult Cardiac Database, the Duke Clinical Research Institute, the Food and Drug Administration, the Center for Medicare and Medicaid Services, as well as Edwards Life Sciences, the sponsor of the first approved transcatheter valve in the United States, have all collaborated together to make the TVT Registry a reality, period. This represents the next generation in outcomes analysis and will capture all patients receiving transcatheter valves in the United States. As with any new endeavor, there are likely to be startup issues and many questions that arise. If you have questions or concerns, please feel free to contact us either by our helpline, by phone, or on the TVT website. We appreciate your interest and more so your participation in the TVT Registry.
This concludes our presentation. If you have any further questions or comments, please feel free to contact us at 1-800-257-4737 or via email at tvtregistry@tvtregistry.org. The Service Center offers product and clinical support Monday through Friday from 9 to 5 Eastern.